the meeting. And this is a press conference to discuss the LIFT Fund as well as the COVID update for today. I'm going to ask the Mayor, go ahead and help us start off in the discussion.
Yesterday, thank you all for being here with us. Yesterday, Dr. Ocaranza confirmed 5 additional cases, bringing us to a total of 40 cases in the El Paso County area. All 5 are linked to community spread. On March 25th, the county judge and I announced a stay home, work safe order. This decision was not an easy one. We made the decision on the fact that lives are more important than livelihoods. We cannot afford to wait until our hospitals are overwhelmed to take action, and we cannot wait until we lose a life to take action. We must heed the advice of the Public Health Authority and take all measures to suppress the spread of the disease. I am working with the county judge to implement further restrictions due to the confirmation of community spread of the virus. We are not yet ready to release those restrictions. I want to remind the public the current stay-at-home order restricts the following. All public and private gatherings of more than 10 people occurring outside or inside a single household or dwelling unit are prohibited, with the exception of those who live in that home. Nursing homes, retirement and long-term care facilities are to prohibit non-essential visitors from accessing their facilities unless to provide critical assistance or for end-of-life visitation. Non-essential business and operations must cease. Non-essential businesses may only continue operations consisting exclusively of employees or contractors performing activities at their own residences, i.e. working from home. I want to remind the public that under the stay-at-home order, the following activities are permitted. You can perform tasks essential to health and safety. You can obtain the necessary service and supplies. You can deliver those services or supplies to others. You can go to work at an essential business. You can care for a family member or pet in another household. You can engage in outdoor activity provided the individuals comply with social distancing requirements of 6 feet. We need to continue to practice social distancing, even when you're out there buying groceries. Do not take the entire family to do essential tasks, and try to limit it to one person if you're able to. Again, we will be implementing further restrictions due to community spread, which will be announced tomorrow. I would like to thank all the doctors and nurses working to care for our community. We must all do our part to relieve the burden on the healthcare industry. We understand the burden and strain on the small businesses and across our community. I think this is what keeps Judge Samaniego and I up at night, frankly. It's not an easy decision to make. It is very important that residents and businesses cooperate to make this effort as successful as possible to keep our community healthy. We've launched mobile testing sites for first responders, for medical personnel, and for those over 65. No doctor's orders are needed, but you must meet the criteria of having a temperature of at least 99.6 degrees Fahrenheit or higher. Testing is free and requires no insurance coverage. This is a stressful and uncertain time that we're all dealing with, and I want to urge everyone to stay calm. Emergence Health Network is also a resource for people, and I want to encourage you to consider doing blood donations. They're down. Small businesses are the backbone of the American economy, and they are especially here in El Paso. COVID-19 has had a tremendous impact across the country. El Paso businesses are facing a financial crisis. The PDN Foundation has established 2 funds. The El Paso COVID-19 Response Fund, which was established by the Paso del Norte Community Foundation in partnership with the United Way of El Paso to support nonprofit organizations serving the homeless and elderly with food, sanitation, and support services. The El Paso Food and Beverage Workers Fund was established by a group of local service industry volunteers to provide relief to food and beverage workers who have been laid off or working significantly reduced hours due to a temporary closure as a result of the pandemic. I also understand that the El Paso Community Foundation has set up a fund as well, and I don't have the particulars on that. Today, the city and county have each of us have approved $1 million to the LIFT Fund for the establishment of the El Paso Small Business Emergency Relief Program. Through the program, eligible businesses will be able to apply for 0% interest loans and grants to alleviate the economic pain being caused by this COVID-19 pandemic. Small interest-free business loans of up to $25,000 and grants up to $5,000. Businesses with 10 employees or less can apply for a loan. Businesses with 5 employees or less can apply for a grant. In order to qualify, businesses must have been operating since August of 2019, have good credit, and must prepare a 6-month recovery plan and work capital plan that demonstrate the award will help them get through this time of uncertainty. The LIFT Fund conducted a study that concludes that for every dollar they lend, it generates $14 into the economy. That means that this program should generate $23.8 million for our economy. During this time of uncertainty, many small businesses have been forced to close in order to protect the community from the spread of COVID-19, and this program will provide an opportunity for them to reopen after restrictions are lifted. This partnership can also be established by financial institutions or other private organizations, and I encourage them to participate in this initiative. We need to come together and support our local businesses as we all recover economically. Thank you. And Laura, turn it over to Judge Samaniego.
Yes, sir. Judge Samaniego,
Okay.
Can you?
Yes, and thank you for being with us and staying tuned to what some of the things that we have to do. Mayor, thank you very much. As you know, there's 2 different orders, one from the city, one from the county, and the mayor and I have worked extremely hard to align these orders so that we don't have any confusion. As expected, our community overall has done an excellent job. Unfortunately, there's some areas that have concerned us in the area of recreation, in the area of construction, and the mayor and I are working really diligently on this, later today and having more specifics. One of the things that we agreed on was that we needed to be more specific as to what's essential and what isn't, so that there wouldn't be any confusion. But we've talked about it, the mayor and I have talked about it over and over, that we want to contain. It's more important that we have a short term, and we address things at a short term than allowing them to become, overwhelming for all of us, and that we have a long-term situation here in our county and city. And so we know we need to flatten the curve. We know that we have to do certain things that are very difficult, but we know that we're following medical advice. Dr. O and the medical profession are guiding us and letting us know what we should and shouldn't be doing. And then we have to look at the collateral impact of those decisions. And we're very, very sensitive, very cognitive about the fact that our businesses are getting, are having an impact. We understand the importance of our businesses in our community. It's difficult. Myself as a small business owner, we know what we have to go through. But we also, I think once people understands that if we could contain it and flatten that curve, that we begin to get some traction and see some light at the end of the tunnel. We are very close. In our case, the mayor talks to mayors from all over Texas, myself, mostly the 6 largest counties. I'm part of that, or the county's part of that. And we know that it's not an easy thing to address. We're not there yet. There is going to be some long-term effects, and so we're ready as a community. Once again, we don't want to be closing the valve simply because people are not adhering to some of the directives that are out there. If you adhere to them, that allows the mayor and I to allow some sense of flexibility. When you don't adhere to them, then obviously we're going to look at what the medical profession is telling us. So in the same way, for this impact, I want to thank the Lift Fund and Lupe Mares. Thank you so much. She's a Vice President of Southwest region, and we thank you for what you're doing, and we thank you for that leadership to you and all your team. Very concerned about the businesses, and I know the Greater Chamber, the Hispanic Chamber, the SBA. We're all trying to do something that minimizes that impact that we're going to have in our community. But first of all, if we contain it as much as we can now, we don't suffer some long-term consequences. So we ask the community, to do the right thing. The spirit of the order is to stay home. And if you follow that principle, you have to stay home and don't do anything that's non-essential, then that should give you the guidelines. But then there's other ways by checking in on us, our press conferences, the information that's out there. But like I said, one of the commitments that the mayor and I have is that we're going to try to be a little bit more specific so there won't be any confusion, or at least as minimal confusion about what's essential and what isn't. Once again, I thank the public, the community. We have this great community. We know how to respond to these situations. We still have a few people maybe not getting the communication. Hopefully that's the issue, and the mayor and I will work very hard on trying to get everyone to understand what do we need to do to flatten this curve. So once again, thank you. And like I said, the mayor and I are aligned very strongly. That's not the case in all the different parts of Texas. And I think that's one of the reasons that we've been successful. We have our legislators are really working with us, our community, our Congresswoman, Congressman Hurd. Everyone is really pulling together, and I think that you would be proud of the leadership that has taken place to address this incredible virus. So thank you very much.
Thank you very much, Judge. I'm now going to open it up to Ms. Lupe Mares. Ms. Lupe, if you could please unmute yourself. Thank you.
Thank you so much. And Honorable Mayor DeMargo, City Council members, County Judge Ricardo Samaniego, and County Commissioners, on behalf of Lift Fund, a nonprofit small business lending company in El Paso, and our small business community, I would like to thank you from the bottom of my heart for coming together to make this happen. I would be remiss not to thank our city manager, Tommy Gonzalez, and his team, El Paso Economic Development Director, Jessica Herrera, Eddie Garcia, and Mireya Crego, and from the County Economic Development Director, Andrea Hutchins. Andrea, thank you for listening to me and trusting me enough to go back to Jessica and working as a team to make this happen. As Mayor DeMargo mentioned, we are taking $1.2 million of the $2 million that has been granted to Lift Fund, and we are making loans for $25,000 at 0% interest rate with a 4-month deferment to small businesses with 10 employees or less. We will take $500,000 and offer $5,000 grants to businesses with 5 employees or less. The remaining $300,000 will be used to buy down the interest rates of the loans to 0%. This wonderful opportunity will be available on Wednesday, April 1st on our website, liftfund.com, under COVID-19 Disaster Relief Program. I encourage you all to visit that website and learn more about the application. I'd like to also mention it in Spanish, so permítame explicárselos cómo va a funcionar la colaboración con la ciudad y el condado de El Paso. De los 2 millones, Lift Fund utilizará 1.2 millones para ofrecer préstamos de 25,000 a una tasa de interés del 0% en un aplazamiento de 4 meses para negocios con 10 empleados o menos. Utilizamos otros 500,000 para ofrecer subsidios de 5,000 a negocios con 5 empleados o menos. Los 300,000 que quedan vamos a utilizar para poder ofrecer la tasa de interés de los préstamos de 0%. Esta maravillosa oportunidad estará disponible el miércoles 1 de abril de nuestro sitio web liftfund.com bajo el programa de ayuda por desastre COVID-19. Ánimos a las pequeñas empresas que necesitan apoyo a visitar nuestro sitio web para obtener más información y comenzar el proceso de solicitud del 1 de abril. Para empresarios en el condado de Doña Ana y la ciudad de Las Cruces, LIFAN está en el proceso de finalizar un contrato de $3 millones para ofrecer préstamos de $25,000 al 3.75% de interés con aplicamiento de 4 meses. El Estado de Nuevo México garantizará el 80% del préstamo. LIFAN invita a las organizaciones públicas y privadas y grandes empresas en nuestras comunidades a que se aunan a nuestros esfuerzos y nos ayuden a recaudar fondos para poder ofrecer nuestros préstamos al 0% interés. We always talk about being a border region, which includes El Paso, Las Cruces, and Ciudad Juarez. We have not forgotten our small businesses in Doña Ana County and Las Cruces. LIFAN is in the process of finalizing a contract with the New Mexico Small Business Investment Corporation of a $3 million investment to offer loans up to $25,000 at 3.75%. The State of New Mexico Economic Development Department will guarantee the loan up to 80%. I am challenging the City of Las Cruces and Doña Ana County to help raise $500,000 to buy down the interest rate to 0%. The funds do not need to come solely from the city and the county. Financial institutions in New Mexico can pitch in towards that buy down, as well as other public entities and large businesses. This is a call to action to help our small businesses in Doña Ana County and Las Cruces. How often do we make that drive to eat at Chopes or shop in Mesilla or eat at our favorite restaurants in Las Cruces? Let's work together as a region and make this happen. Thank you again, Mayor DeMargo, City Council members, County Judge Ricardo Samaniego, and County Commissioner for your leadership and commitment to supporting small businesses when they need it most. I know we are El Paso strong, and we will get through this together. To our community, please remember to support our small businesses and shop local. Please stay safe and healthy. God bless.
Thank you, Ms. Lupe. I now would like to invite Dr. Hector Ocaranza to please give us an update as it relates to the current situation as it relates to COVID-19. Dr. O.
Hello, good afternoon. And this is going to be an update for the number of cases, COVID-19 in El Paso. First of all, I want to say thank you to all our healthcare providers, workers, first responders, all that are in the healthcare industry for all the tremendous work and help that they can give into our members of our community, especially the most vulnerable ones. They're doing an exceptional job, and I want to just say a thank you. As far as the cases, we have 6 new cases that we need to report, bringing up to the total count of 46 cases of COVID-19 in our community. Most of those are females, and 75% of those cases are young adults. This brings a good opportunity to tell all those young adults that please, the stay-at-home order, it has the primary purpose of promoting social distancing. We would like to remind everybody to stay at home, stay just with your family. Don't go and have big gatherings at somebody else's house. Please observe the 6 feet apart between each other when you go out, and choose one member of your family to go out and do all the necessary grocery buying and necessities that you need to get for the whole household. We are keeping an eye on all the situation, and especially how the virus is affecting our community, and we will continue keep a close attention to those patients that are mostly vulnerable, that are mostly admitted to the hospital, because that will give us more information as far as the severity of the disease in our community. We are expecting that we will continue seeing positive cases of COVID-19 in our community, and as we open more of the testing to those people at risk, we will continue seeing those cases but hopefully with all the help from our community, by helping each other, by each of us taking responsibility of staying home, we will not overwhelm our healthcare services, and we will be going through this pandemic the best possible way. It is extremely important to look at the collaboration between all the leadership in our community, Judge Samaniego, Mayor Margo, and everybody in their leadership coming together and looking at doing the best possible decisions to preserve health and keep everybody safe. Thank you.
Thank you, doctor. Si me puede hacer el favor, doctor, en español otra vez.
Claro que sí. Para todos los miembros de la comunidad queremos extender nuestra más sincera gratitud a todos aquellos miembros del equipo de salud de todos los hospitales, médicos, enfermeras, todos los paramédicos y todos los que trabajan en los servicios de salud. Han estado haciendo un trabajo estupendo, cuidando de nuestra salud y cuidando de aquellos que son más vulnerables. Le queremos anunciar a la comunidad que tenemos 6 casos nuevos de COVID-19 en nuestra comunidad y la vasta mayoría de estos casos, el 75% es en adultos jóvenes. Estamos viendo que las mujeres están afectadas un poquito más que los hombres y el hecho de que el 75% de estos casos que hemos encontrado en adultos jóvenes nos da la oportunidad de decirle a la comunidad que todos aquellos que piensan que están sanos, que son adultos jóvenes, fuertes, no van a estar afectados. Aquí estamos viendo que no es así. Por favor, siga las recomendaciones que les hemos dado de quedarse en su casa, de que escojan una sola persona en su casa para hacer el mandado, para salir a recoger todas las cosas esenciales que necesitamos para nuestra familia y que cuando estén afuera observen la distancia que les hemos indicado de 6 pies o 2 metros entre una persona y otra. Lávense las manos frecuentemente y si está enfermo no salga, no vaya a trabajar y por favor hay que seguir las recomendaciones, seguir las órdenes que les hemos dado. Toda la gente que participa y que son los líderes de nuestra comunidad, como el juez Samaniego, el alcalde Margo y todos los demás líderes en nuestra comunidad, nos juntamos todos preocupándonos de la salud y el bienestar de nuestra comunidad y estas decisiones, aunque no son fáciles de tomar, son las que creemos que son necesarias para mantenernos en buen estado y poder sobrellevar esta pandemia hasta una resolución mucho más favorable. No queremos inundar nuestros servicios de salud a un punto en que no podamos proveer de esos servicios a la gente que lo necesita y es la razón por la que seguimos insistiendo de que el distanciamiento social es la mejor opción para poder disminuir la transmisión de este virus, que ahora ya sabemos que tenemos una dispersión en nuestra comunidad en la cual la gente se puede infectar sin tener historia de viaje a algún otro lugar. Muchas gracias.
Gracias, doctor. We will now open it up to the questions brought by media. I will be reading the media requests that have been sent to us for this meeting. The first question that we have is, some folks have been getting a doctor's note that says diagnosis coronavirus, but they are not able to get an actual test. Is it correct to assume that this means they are not being counted in the city's numbers? Doctor.
Yes, that is correct. Those are not laboratory confirmed cases. It's just a suspicion that the medical provider has that this patient might have signs and symptoms of coronavirus, so therefore they're not counting the numbers that we have. We know that if we do not test these individuals and they just go to the emergency room or some other providers and the test is not performed, this diagnosis is not a sure diagnosis, it's just a suspicion. Y ahora en español, la pregunta era de si los casos en los que las personas van a recibir atención médica y el proveedor de salud les pone que tienen diagnóstico de coronavirus, es seguro decir que estas personas no se han contado en el número de casos que tenemos positivos. Y la respuesta es de que este número de casos que vemos en donde el proveedor de salud le pone un diagnóstico tentativo de coronavirus no son unos casos que se han comprobado, dado que no se ha hecho la prueba y la comprobación de que están infectados con el virus. Y muchas de las veces los proveedores de salud, cuando tienen la sospecha de los síntomas de la infección por virus COVID-19, pueden poner el diagnóstico presuntivo de esta infección, que no necesariamente indique que tiene.
Doctor, el fin de lo que dijo no se oyó completamente. ¿Si lo puede repetir lo del fin?
Estos casos en los que se da un diagnóstico presuntivo de coronavirus no significa que tengan la enfermedad, sino que solamente el proveedor de salud que revisó a estas personas tuvo la sospecha de que estaban infectados.
Muy bien, gracias. The second question, is it true that people aren't able to get tested even with a doctor's note referring them to be tested unless they are hospitalized?
What is happening is that people can get tested, and in many instances, they need to collect the sample either at the drive-through testing for the doctor's order, or given the risk factors, some individuals will not need the doctor's order through the drive-through testing. There's other venues where people can get tested, and that sample has to be sent to those outside labs, private laboratories. At the Department of Public Health Laboratory, we're focusing our efforts in those people that are hospitalized and those people that are in critical condition, because that will give us a lot more epidemiological information as how the virus is behaving in our community. There are many venues where people can get tested, and the Department of Public Health is not the only one. Y ahora en español, la pregunta era si las pruebas que se están haciendo son solamente para pacientes hospitalizados o no. Y la respuesta para esto es que la gente tiene muchas opciones de dónde hacerse la prueba. Pueden tomarse la muestra en el drive-thru con la orden de su médico, pueden tomarse la muestra si pertenecen a un cierto grupo de personas de riesgo en el cual no necesitan la orden del médico, pero si tienen la orden del médico y el médico considera que necesitan hacerse la prueba, pueden colectar la muestra, ya sea con el proveedor de salud, y llevarlas a algún otro laboratorio. Varios laboratorios privados realizan este tipo de pruebas y pudieran tener el resultado de esas pruebas. El laboratorio del Departamento de Salud del Paso se enfoca todos sus esfuerzos en los pacientes más vulnerables, y eso significa que son los pacientes que están ingresados en los hospitales, sobre todo en los que están en terapia intensiva, porque eso nos vaya a dar mayor información epidemiológica de la virulencia de esta enfermedad y de qué tanto nuestra comunidad está siendo afectada por el virus.
Thank you, Doctor. The next question. Health officials across the country have said widespread testing is needed to identify COVID-19 patients and slow the spread. But no one seems to be able to say how many tests have been conducted in El Paso. Is it possible to gather data from the private labs to add to the number from the health department? And this question may, I don't know if Dr. if you can answer it or if it could be something that Chief D'Agostino or Assistant Chief Jorge Rodriguez might be able to answer.
I don't have personally those numbers, maybe Chief.
Hi, Chief, if you could introduce yourself first.
Jorge Rodriguez, Assistant Fire Chief and the Emergency Management Coordinator for the City County Office of Emergency Management. So we are, as far as our drive-through, we do have a large amount that are going to the private labs. We instituted that last week. There is a process which the federal government will make those notifications down to the Department of State Health Services.
Chief, you're too far from the mic. Can you scooch in? Chief, can you scoot in for a little while, a little bit closer to the mic? We can't hear you. You cut off. Thank you.
Okay. Where did you lose me?
From the beginning.
Okay. So currently, through the drive-through, the vast majority of the cases that are being tested there are being sent out to private labs. The private lab turnaround is anywhere between 4 to 5 days. The process using the federal assets that we're utilizing for that particular lane, it takes, it's a notification that's made from the federal government down to the Department of State Health Services and then down to the Department of Public Health. Those individuals that go through that drive-through get a notification from them. So that's the process, and as we continue to collect the positive results, we know how many we're running through, but as we wait till that notifications come down, we don't have an accurate count of those done from the private side.
Thank you, Chief. If Dr. O could possibly translate for you.
Tenemos diferentes carriles en los cuales se han hecho las pruebas y tenemos ciertos números de este número de pruebas que se han hecho en total, en los cuales hay ciertos positivos, ciertos negativos. No tenemos un número exacto en cuanto a las pruebas que se han realizado por laboratorios privados. Los números que tenemos se refieren a los que se han realizado a través de este sistema que se ha implementado de drive-thru, y por parte de los laboratorios privados nos reportan los resultados que son positivos en nuestra comunidad.
Gracias, doctor. The next question is for Ms. Lupe Mares. Ms. Lupe, how does this fund work with the expansion of the SBA loan program in the CARES Act? Could accessing this loan fund jeopardize a business eligibility for an SBA grant? And I don't know if you can answer, Ms. Lupe. I understand that Jessica Herrera is also on the phone call, so she, if you, either you or Jessica might be able to answer it.
Well, thank you so much, and great question. And so all that is being clarified right now. We are still trying to clarify a lot with this SBA as far as how all this is going to work. If whoever applies for an SBA can also apply with LIFN or for other lenders, with other lenders. And so at this point, for me, it is still unclear. We're daily having calls and trying to find out exactly how all this is going to work. Jessica, I don't know if you have more information than that.
No, I would agree with Lupe. I think at this time we just encourage business owners to please contact Lift Fund should you be interested in these loan programs or micro grants that would be available, because I think it's just important to take a look at opportunities such as this that are more flexible.
And Ms. Lupe, I would ask you if you might be able to translate your comments in Spanish.
Ok, gracias. Entonces, ahorita estamos esperando, vamos a ver cómo el gobierno quiere que hagamos estos préstamos. Nosotros ahorita ya estamos, para el día 1 de abril, como les expliqué, vamos a estar disponibles para empezar a ayudarles con esos préstamos y también la solicitud. Y pero ahorita no sabemos bastante, estamos aprendiendo cada día del gobierno cómo exactamente van a trabajar estos préstamos.
Muy bien, gracias. The next question will be in Spanish. ¿Cuáles son las nuevas medidas de seguridad y restricción que serán implementadas por la ciudad y el condado debido al incremento de casos de COVID-19? Doctor, si puede contestar en inglés, en español primero y luego en inglés.
Las medidas de restricción que se van a implementar, se están trabajando muy cuidadosamente entre la ciudad y el condado. En cuanto tengamos todas esas reglas finalizadas y las órdenes, se les dará a conocer a toda la comunidad. Pero lo importante de esto, una es el tratar de controlar y mitigar la expansión comunitaria del virus, con la cual vamos a evitar el saturar nuestros servicios de salud. Las órdenes y reglas que se implementan y que se seguirán implementando no son para atacar a la comunidad, sino al contrario, son para protegerlas, y queremos tener una comunidad sana y saludable, y de esa manera queremos exhortar a todos en nuestra comunidad que sigan las órdenes, sigan las reglas. Todos debemos poner de nuestra parte, y esto es bien importante y es urgente que la gente haga caso. Es urgente que tomemos esto en serio para que no tengamos un problema mucho más grande. Now,
in English, the question was, what are some of the restrictions of security restrictions that are being proposed by the implementation by the city and the county as a result of the increase of cases?
The orders and rules that are going to be implemented are still being worked between the city and the county, and the rules are meant to actually protect lives. All the rules and orders that have been given to the community are with the sole purpose of preserve health, not overwhelming our health system with uncontrolled transmission of the COVID-19 virus, and ultimately we're looking in saving lives.
Thank you, Doctor. The next question is from Ms. Lupe. Lupe, en español, la pregunta es, ¿habrá un límite de pequeños negocios que podrán aplicar para los fondos del LIFT Fund?
Gracias, muy buena pregunta. Pues cuando se acabe el dinero, el 1.2 millones, entonces en ese tiempo vamos a tener que parar, pero por eso les pido a los negocios, a los bancos financieros que por favor nos ayuden y que nos sigan dando para poder ayudarles a los negocios chicos de aquí de El Paso. In English, the question was about how many loans will we be able to make, and if all of the loans were for $25,000 each, we would help about 52 small businesses. However, of course, we know that there's going to be some small businesses that are going to request less than the $25,000. As soon as we run out of that 1.2 million, that'll do it. So that is why I'm asking financial institutions, with the Community Reinvestment Act, to please step up and to please help some of these small businesses, so to help them with that 0% interest rate.
Thank you, Ms. Lupe. The next question, are you satisfied with El Paso's current COVID testing capacity? Based on the amount of testing being seen in El Paso, are we flattening the curve of COVID-19 spread? Doctor, can you help answer that question?
Yes. No, I'm not happy yet at the amount of testing that we're doing. And actually, what we're forecasting is that the next 4 to 6 weeks, that's when we're going to be seeing some of the peaks of the spread of COVID-19 in our community. We are taking a very close look at how the virus behaves in the community, and more testing has to be done and will be done. And that's the reason why we're expanding the testing capacity in our drive-through. And another important thing to remember is that private laboratories are doing some of the testing. They are another venue that they can take, and physicians are doing a wonderful job in evaluating patients and sending for that kind of testing.
And en español, ¿está satisfecho, doctor, con el número de pruebas que se andan haciendo para el COVID-19? Y basado en el número de pruebas que están viendo en El Paso, estamos viendo el esfuerzo de reducir el número de casos de COVID-19.
No estoy muy satisfecho en cuanto al número de pruebas que se han hecho, pero seguimos continuando y redoblando los esfuerzos para poder hacer más pruebas y tratar de tener una mejor idea de cómo la transmisión del COVID-19 sucede en nuestra comunidad. Estamos enfocados en cómo el virus se manifiesta en nuestra comunidad, sobre todo en las personas más vulnerables, y por eso muchos de nuestros esfuerzos se han enfocado en las personas que están hospitalizadas y en las personas que se ingresan a las terapias intensivas. Seguiremos esforzándonos por continuar con esta prueba, pero más importante es el mandar estos mensajes de prevención a toda la comunidad, establecer órdenes y reglas para hacer ver a la comunidad que esto es algo serio, que esto es algo que tiene que tomarse con mucha importancia, y todavía nos faltan otras 4 a 6 semanas de ver cómo el virus se sigue propagando. Esperamos ver una disminución en la transmisión y esperamos ver que esta curva se haga mucho más plana y no tengamos picos, pero todavía esperamos que mucho más viene en las próximas 4 a 6 semanas.
Gracias, doctor. The next question, how do you all plan to measure the success of policies implemented to stop the spread of COVID-19 in our community? Doctor, maybe you can answer that for us.
Yes, we are monitoring hospital admissions, the use of healthcare resources, and case fatality rates in El Paso as a measure of success of all the policy that we have implemented in El Paso. We know that other cities have had a surge of positive cases, and they're having surge capacity in their healthcare systems. So far in El Paso, we haven't seen that, and we've instituted policies where they're aimed at anticipating.
Doctor, we didn't hear that last part. Can you repeat that?
Yes, and all the policies that we have implemented are aimed at not seeing the surge in demand of healthcare services.
Thank you, doctor. Can you repeat that in Spanish?
Yes, of course. Las políticas que se han implementado en nuestra ciudad tienen el firme propósito de disminuir la demanda de servicios de salud en nuestra comunidad debido al COVID-19. Hemos visto que en muchas otras comunidades y ciudades los servicios de salud se han agotado por el aumento tan drástico que tuvieron en el número de casos y en la severidad de los casos de COVID-19. Implementamos nuestras políticas, órdenes y reglas mucho antes con el propósito de evitar ese tipo de problemas en nuestra comunidad.
Gracias, doctor. The next question, what is the status of the first recorded positive COVID patient in El Paso? It has been approximately 2 weeks. What is their condition? Were they hospitalized? Have they recovered? Would it be possible to interview them? And my suspicion, doctor, is that with regard to interviewing them, that would be a decision that the individual would have to make.
That is correct, and we cannot disclose out of privacy, name, location, anything like that, but we're happy to report that those initial patients are out of isolation and they're doing well.
Si puede en español, la pregunta fue, ¿qué sucede con los primeros casos de COVID-19 en El Paso? Ya han sido 2 semanas. ¿Qué son las condiciones de estos pacientes? ¿Fueron en el hospital?
Estos pacientes, los primeros casos que tuvimos, no les podemos dar nombre, dirección, nada debido a la privacidad que necesitamos tener. Que sí podemos.
Doctor, no se puede ir.
Sí. Can you hear me now?
Yes.
¿Ahora sí se pueden oír? Bueno. Lo que no podemos darles el nombre, dirección, nada de los datos personales de estos pacientes debido a la privacidad que necesitamos mantener en respecto a estos pacientes, pero lo que sí podemos informarle al público es de que estos pacientes ya salieron de su aislamiento y están en buen estado.
Gracias, doctor. La siguiente pregunta será, un momento. How many of the current confirmed patients are hospitalized? Of those, how many are in the ICU?
We have that. I don't have that information at this time of the hospitalized patient or how many are in the ICU. One thing that we do know is that we have no fatalities so far here in El Paso, and I'm really happy about that. We cannot let our guard down. We will continue our efforts. Y en español, tengo la información de cuántos casos están hospitalizados en este momento y cuántos están en terapia intensiva, pero lo que sí sabemos es de que no ha habido ninguna muerte debida al COVID-19 y esperamos que así nos mantengamos y seguimos esforzándonos para que la situación continúe sin reportar muertes debido al COVID-19.
Gracias, doctor. The next question. We have interviewed a woman who was diagnosed with COVID-19 by her doctor, who called her case as a presumptive positive case. She says she received a referral to get a test, which was denied. Are people being turned away at this point? Doctor, I don't know if you can answer or if it would be Jorge, Chief Jorge Rodriguez.
Well, given the testing capabilities, we're doing some of the testing through some of the collection of samples, more than the testing, collection of samples Monday through Friday. But as far as the testing, there's many options and venues that can be done to perform the testing. As mentioned before, private laboratories can do testing. We're going to be focusing in those that are hospitalized and in ICU through the Department of Health, but there are many other venues to do the testing. As far as collection of samples, the drive-through testing is still Monday through Friday up to now.
Doctor, en español, por si me hace el favor. Gracias.
La pregunta era de acuerdo a un paciente que se dio un diagnóstico presuntivo de coronavirus, el cual no se le pudo realizar la prueba durante el fin de semana. Pero hay muchas cosas en cuanto al proceso que se lleva y los pacientes que su doctor determine que pueden hacer la prueba, pueden tomar esa muestra y mandarla a cualquier laboratorio privado el cual le puede realizar las pruebas. En cuanto a la colección de muestra por medio del drive-thru que tenemos, eso se realiza lunes a viernes con previa cita, y en cuanto al realizar pruebas por medio del laboratorio del Departamento de Salud, nos seguimos enfocando en pacientes que son hospitalizados y que están en terapia intensiva.
Gracias.
All right, we're going to continue to monitor this briefing right now. Some of the key takeaways, of course, El Paso Mayor DeMargo says stricter stay-at-home orders will be coming for the city and the county tomorrow. We also learned that there are 6 more confirmed cases in El Paso, bringing the total to 46. Also, $1.2 million is now available for small businesses that meet certain criteria. That money will be doled out in loans of $25,000 and $5,000 with 0 interest. We're going to have a full update coming up on KTSM 9 News at 10, and of course throughout the evening on KTSM.com and KTSM social media. We'll see you.